I'm Cecilie Ejerskov, and my role in this study was I was a principal investigator on this nationwide cohort study on Neurofibromatose type 1 and plexiform fibromas. So NF1 is a rare genetic disorder, and the clinical manifestations are also the ones that goes for the clinical diagnostic criteria. So most physicians will know NF1 from cafe spots, freckling, and also hamartone of the iris. But there will also be more severe complications as optic pathway glioma, the plexiform neurofibroma, and also pseudoarthrosis of the bone and severe scoliosis. So it manifests in childhood with more mild symptoms mostly, and most of the time we have a clinical diagnosis by the age of 11. But some of the symptoms and manifestation will severe and progress into adulthood. So there's a great variety of symptoms when you have NF1 or clinical manifestations that could occur during your lifespan. So the study clinical characteristics and management in children and adults with NF1 and PN examines, first of all, how many NF1 patients do we have, what is the percentage of PN both in small and large, and also we looked at how many of them has undergone surgical procedures and the location of the body and also the symptoms. A PN, plexiform fibroma, is a benign nerve sheath tumor. So it's a nerve sheath of the peripheral nerves that grow into either a nodular mass or can also be diffuse growing and actually invasive in the tissue around it. We had no knowledge on our real-time data on PN in our NF1 population. So that was like the overall scope of the study. We know from the literature that about 30 to 50% of patients with NF1 should have a PN of any size. We also know that they cause symptoms like disfigurement, pain, neurological deficits, and it's difficult to treat and manage. So far, we had the option of surgical removal if possible, or just wait and see. And we do know that surgical removal is not often an option due to the invasive growth of a plexiform neurofibroma, but also due to a lot of hemorrhage during the surgical procedures. Furthermore, it was the whole management. How do we screen, follow up and management our PN in our population? And what actually treatment of opportunities do we have? So we needed our own real-time data here in Denmark to find out in our NF1 population how many actually do have a PN, how large are the PN, and what have been our standard of treatment for the past 20 years, and how many can we actually do a surgical procedure on. One of the major findings is that PN is common in our NF1 population in Denmark, and it increases with age, both in prevalence but also size. So we found 1,100 patients split amongst the two center rare diseases, and in 1/3 of them, both child and adulthood, they actually had a large PN being over the size of 3 centimeters. 1/3 of these large PNs were actually inoperable, understanding from our side that we have quite a severe manifestations in our NF1 population where we don't actually now have a proper treatment with the patient having to live with the PN because there's no option of surgical removing it. If we look at the PNs that had performed surgery, we can see some of them actually had surgery done more than 5 up to 11 times, which also gives us an understanding that these patients are actually undergoing surgical procedures quite often without the full result to it. Furthermore, the findings of the study gave us a good insight in the symptoms. And the symptoms are predominantly pain and neurological deficits, but we also see cosmetic issues and disfigurement, and that's due to the size of the plexiform neurofibroma. When it comes to the anatomical location, it was predominantly in the lower extremity, upper lower extremity, which also corresponds to our daily findings as well. Something that was important for us as well was to find out how many of these PN actually turns into malignancy. And that would be a rare sarcoma with a really horrible prognosis called malignant peripheral nerve sheath tumor. And we found it was 2% of the population, which is high compared to the background population. And it also corresponds to what is known internationally. So these were actually our major findings of the study that helps us with understanding our NF1 population and the severity of PN in this population. So in general, NF1 is known to be a mild condition. Most physicians know about the Genfejl spot and the freckling, but not many physicians know about the more severe manifestations that a child with NF1 can grow into later in life. So this study headlights and underlines a lot of the concerns that we had as center rare diseases. And of course, NF1 patients are seen at the two center rare diseases, but actually most hand-on happens in different departments. So a lot of NF1 patients, they are seen at a dermatologist, some endocrinologist, some neurologist, some orthopedic surgeon that treats whatever issues and clinical manifestations they have. And a lot of patients, NF1 patient actually has a close relationship to the general practitioner, which means that we rely on a good relationship with the patient, but also with our colleagues. And for us, it's important that the other physicians in different departments and the general practitioner also know that in general in the NF1 population, there is a high load of plexiform neurofibroma, which can cause all these symptoms and also transform to malignancy. Hence, we would like to have the opportunity that the patient do come to center rare diseases, and we can help with this screening follow-up management program. Of course, co-joined with the GP and the other departments as well.